Also, we are live. Welcome. It's pharmacology review. And remember, pharmacology is an important part of your NCLEX. And so today we are going to tackle some high yield content for pharmacology. So let's start right away. And I am your tutor, Dr. Julia, joining you from Ontario, Canada. So let's start right away. All right, good to have you join us from UKP. Good to have you. So let's dive right into our review. And as we do it here, we would always want you to know how important it is to master pharmacology. How important it is to master pharmacology. Remember that for the NCLEX content, for every subject area, there are more like a percentage for each area. And pharmacology comes under physiological integrity, and over here, pharmacological and parenteral therapies covers about 13 to 19%. So from the percentages here, it looks like pharmacology covers a huge chunk of the questions that you may meet. And you know that the format for the exam is CAT, computerized adapted testing. So it's going to adapt to how you are answering the questions. So you may have two candidates sitting side by side for NCLEX, but they all going to be presented with different questions based on how they are answering. So it's important that you master pharmacology. So that is why we are preparing you as well with the pharmacology crash course. Today, we're going to cover some high yield areas, but it's not going to be exhaustive. So do well to jump on the crash course as soon as possible. I'm going to share the link. So I just want you to have a brief idea of what pharmacology for NCLEX is all about. You would have to cover these areas. I'll just run through the topics. Medication administration safety, you should be on top of it. Drug classification, so diuretics, cardiac medications, all the different kind of drug classifications, you should master it. Antibiotics and anticoagulants, you should read and master them. Psychiatric and pain meds, toxicity and antidotes. So if a client has had an overdose of medication, what will you give? Benzodiazepines, you should know that, okay, I'm going to give flumazenil and all of that. Then we have pediatric and geriatric pharmacology. Then pregnancy and lactation. So when you have a pregnant woman, you should know some drugs that should not be given to that woman, and you should know some drugs that are safe. Food interactions and then drug interactions. Whenever you are giving a kind of medication to a client, you should do your client's education. So how would you know what foods that client's supposed to avoid? You should be on top of drug interactions and food interactions with drugs, and that will guide you on what to do. And then we have some common drug side effects and their toxicity signs. You should know it. Because for clients teaching such as inhaler use, a client has inhaler. How are you going to guide the client? So that is very important. So all of these will be stressing you. Oh my God, how am I going to get on top of pharmacology? So that is why we are presenting the crash course for you. This crash course will help you ace pharmacology. And always remember, we are here to support you on your journey. Exams may seem kind of tough, but hey, you are tougher than that exam. So keep pushing, keep putting in the work. You are doing great. So tap the link, secure your spot for the upcoming crash course for pharmacology. So let's dive right into today's session. Are you ready? Give me some thumbs up in the chat box. Ready? Let's dive right into it. So let's start with the first question. I'll be reading it, and feel free to drop your answers in the chat box. Remember, whatever question we are looking here, whatever drug we are looking here is a must know, and do well to jot it down and go read about it, to know about the drug inside out, the indications, what it is used for, the side effects, any drug interactions, any drug food interactions around that particular drug. You do well to master it and get it in your summary notes. So let's look at this question on lisinopril. A client is prescribed lisinopril. Which side effect is the nurse most concerned about? Headache, dry cough, constipation, swelling of the lips and tongue. So let me know, let me get your answers in the chat box. So always look at what the question is looking for. Which side effect is the nurse most concerned about? Side effect is the nurse most concerned about. Okay, I got some answers. I got A from Camille, I got D from Yedika. Awesome, let's look at it. Let's see who got this. The answer is D. Swelling of the lips and tongue. That should be your concern because for lisinopril, angioedema is a life-threatening side effect and it requires immediate action. So always look at what the question is asking of you. What is this question asking of me? And remember, nclex wants to be sure that you are a safe nurse, that your client is on lisinopril and you know the life-threatening side effects. What will kill my patient? So dry cough, yes, is associated with lisinopril, but it's not going to kill the patient in the next few minutes. So you should pick D, angioedema, swelling of the lips and tongue. So always remember, we always want to make it simple for you here with some mnemonics. So lisinopril is under ACE inhibitor. So ACE, ACE. So it will cause angioedema, which is life-threatening, can cause cough, and then elevated potassium. So remember, you may know the answer, but you have to, nclex wants you to be able to analyze the cues that they are giving you and choose the right answer. So you will go for D. Let's look at the next question. Warfarin is a must know, okay? The nurse is teaching a client about warfarin. Which instructions are correct? Select all that apply. And remember, anytime you see select all that apply, it means you can choose more than one answer. And remember that you have plus and minus for select all that apply. So if you are not sure, do not pick, because if you pick a lot, your wrong answers will negate what you got, your positive answers. So let's go through this. You are teaching a client about warfarin. What instructions are correct? A, avoid green leafy vegetables. B, use a soft toothbrush. C, take the medication at the same time daily. D, use aspirin for headaches. E, monitor for signs of bleeding. So let's go. What's the answer? Let's go. All right, got an answer here. Sure, B. Okay, I got ABE from Camille. Did Jessica is sure B and E. It says avoid it, should be limits. All right, let's see. Who got this? Yes, it's B, C, and E. B, C, and E. B, C, and E. So B, use a soft toothbrush. You want to avoid any bleeding. Then take the medication at the same time to get the therapeutic effect. And then E, monitor for signs of bleeding. So yes, keep greens consistent, but you don't avoid. Yes. And then you have to avoid aspirin because of the bleeding risk. You know that warfarin is an anticoagulant. It can cause bleeding. So clients should also avoid aspirin due to the bleeding risk. So let's see what you should remember when it comes to warfarin. That clients will be prone to bruising, long bleeding, excessive gum bleeding. The INR will be elevated. And then if there is bleeding, clients can come with dark stools. So always remember, bleed for warfarin. Easy bruising, they have long bleeding times, excessive gum bleeding, elevated INR, then dark stools. So remember the right answers for warfarin. So do study warfarin inside out. Okay. Let's look at this question. You have a patient receiving vancomycin. So every drug we are looking at today, you must know it is high yield. So vancomycin is an antibiotic. So the client is receiving it via IV, and now reports of ringing in the ears and flashing of the face and the neck. What should you do first? So look at the question will, what is being asked of me? What should nurse do first? So you may have to do some of the stuff here, but ask yourself, what will be life-saving? What should I do first? So A, continue the infusion and monitor the vitals. Stop the infusion immediately and notify the provider. Decrease the infusion rate. Administer diphenhydramine. Diphenhydramine. So what will be the answer? What will you do first? What will you do? What will you do first? Okay, we got some answers. We got B from Kamel. Okay, let me get some more. Let me get some more answers. You are doing so well today. Let me get some more. Okay, we have some more. Okay, please give us B. Nyedeka gave us B. So it's a B day for this vancomycin. Yes, you all got it correct. Stop the infusion. Stop the infusion. Because whatever is being stated suggests that what we call the red man syndrome. So stopping the infusion is a priority. Stop the infusion. Stop it. That's a priority over reducing it or still continue to. If you continue to give it, then you are not a safe nurse. So when it comes to vancomycin, always remember very red and very toxic to the ears and to the kidneys. So it has ototoxicity and it has nephrotoxicity. So always remember, do not miss this for vancomycin. It's a must know. Well done, everybody. Let's look at another higher drug, digoxin. Digoxin is a must know. Let's look at it. A client is taking digoxin. Which of the following indicates toxicity? So then this means you should know about digoxin. So blood pressure 130/80, heart rate 48 beats per minute, blurry vision with yellow halos, then both B and C, which is heart rate low, blurry vision. So digoxin, let's go. Findings for digoxin toxicity. Findings for digoxin toxicity. Okay, I've got C, Nyedeka, I got D, peace. Any other? Any other? Camille says B and C. Yes. Camille got it. Camille got it. Yes, both B and C, because it causes bradycardia. So see how the heart rate is reduced, and then it will cause the blurry vision as well. So bradycardia less than 60 beats per minute, and then you have vision changes with yellow halos. So always remember this demonic dig. Digoxin, as the name implies. So D, decrease pulse. So digoxin. So the D is decreasing your pulse. I, the vision, kind of irregular, that is blurry. Then the G, they would have some gut upset. So always remember digoxin, the D, decrease pulse, irregular vision, GI upset. So go steady digoxin inside out. Okay, let's look at this question. Which findings should the nurse monitor for a client on furosemide? Furosemide is a diuretic. Select all that apply, so that means you can choose more than one. But be careful to get the right answers, otherwise you're going to subtract from your correct answers, okay? So hypokalemia, hypernatremia, ototoxicity means it's toxic to the ears. Then fluid retention and hypotension. So what are you going for? What are you going for? Let's go. Leave your answer in the chat box. You are all doing so well today. Okay, I got A from Peace, hypokalemia. So you select all that apply, so you can choose more than one. A, C, E, A and E. Okay, let's see who got this one. A, C, E, yes. Yes. It's A, C, and E. It causes hypokalemia. Furosemide, hypokalemia. You'll be losing potassium, so it causes hypokalemia. Then C, high IV will also causes, high IV doses will also cause ototoxicity. And then rates of hypotension from the fluid loss. because the client will be peeing a lot, and then low fluid volume, the client can have hypotension. So you cannot have fluid retention because you are rather giving out more urine, because laziness will cause the client to pee a lot. So hypokalemia, ototoxicity, and hypotension. So always remember, it's a loop diuretic. So lose potassium, they're losing potassium. Ototoxicity, your outputs increase, so they are peeing a lot. And then their blood pressure will also drop. The blood pressure will drop. Okay, hypotension. So hypokalemia, hypotension, ototoxicity. Do not forget this. Okay, so let's look at this. So you see that pharmacology is kind of very broad, because every kind of system that you study, you need the pharmacology of that system. If it's neurology, you need the drugs for brain. Gastric, you need the drugs. If you're studying respiratory, you need the drugs. If it's even dermatology, so you see that pharmacology is very broad. So that is why I'm encouraging you all to join the upcoming crash course. I'll keep dropping in the link because I want you all to be a part of this. For only 49 CAD, you will be up your game when it comes to pharmacology, and you will be able to crush the nclex pharmacology. So let's look at insulin. It's given MPH insulin. So you should know the different types of insulin. And the nurse is giving it at 8 a.m. So at what time should the nurse monitor for hypoglycemia? And so it's testing you to know whether you know how NPH insulin works, whether it's long acting, whether it's short acting. So when will you monitor for hypoglycemia? 9 a.m., 10 a.m., 2 p.m., 11 p.m. So if you are not on top of insulin stuff, insulin content, will be difficult to get this question correct. So let's get the answers. No answers yet. Okay, so here in Zoom, we have CCC. Okay, everybody's CCC for Zoom. Yes, well done, well done, well done. You got it. Because NPH, it will peak around 6 to 8 hours after administration. So 2 p.m. will be great if you gave the dose at 8 a.m. Okay, so 6 to 8 hours. So remember, MPH is not in a hurry. That MPH, as the name implies, I'm not particularly hasty. I'm not in a hurry. So the peak action will peak in about 6 to 8 hours. So you all got it. Well done. I'm proud of you. Let's look at the next question. This is on inhalers. So this is another kind of question that you can meet on your NCLEX, that you have an arrangement and you're supposed to do the rearrangement to put it in the right order. So put the steps for using a metered dose inhaler in the correct order. So as you're doing the exam, you hold on to your mouse and then you are moving it around, move it to the first one. This is the second step. So you should be used to these type of questions as well. So we have a free resource which gives you the different kind of NCLEX questions that you can meet, the types, and then how you can go around it. So do well to join our Telegram group. Yes, we have all the free resources there. I'm going to share the link. You can join the Facebook group. You can join the WhatsApp group, and you have access to all the free resources that we have. So let's do the rearrangement. So what will come first? So exhale completely, shake the inhaler, press and inhale deeply. Hold breath for 10 seconds. Wait 1 minute between the puffs. So let's arrange. So this is 1, 2, 3, 4, 5. So which will come follow? Let's go. Let's go. Let's go. Let's go. Which will come first? Which will follow as number 2? Let's go. Drop your answers. Let's do the rearrangement. Just take it like you're writing the exam and do the arrangement quick. Okay, so 2 is first for you. Okay, so shake inhaler. Then what will follow? Camille, let's go. Shake inhaler. So yes, I'm shaking the inhaler. So what next? Let's go, let's go, let's go, let's go. Okay, yeah, then 3. Press and inhale deeply. Okay, then what's the next one? What is the next one? Just take it like have the client in front of you. Okay, then 4, hold breath for 10 seconds. Then here the card has 2, 1, 3, 4, 5. So 2, shake inhaler, exhale completely, press and inhale deeply, hold breath for 10 seconds and wait 1 minute between the puffs. Okay, please give 5 to start with. You are all doing great. I see. So yes, this is the order. Shake, you got it. Exhale, inhale, press, then hold, and then you wait. So shake first, exhale, inhale, plus press it, then hold, and then wait. So shake, inhaler, then you exhale, then press and inhale deeply. Then hold breath for 10 seconds. So that's the last but one, the holding of the breath. Then you wait 1 minute between the puffs. Okay. So shake, exhale completely, press and inhale deeply, hold breath for 10 seconds, then wait 1 minute between the puffs. That is the correct order. Shake, exhale, inhale, hold, then you wait. Okay, so that is the proper sequence. That will help effective delivery. So shake, breathe out, inhale, hold, and wait. So that is the order. Shake, breathe out first before you wait, and then hold, and then wait. Awesome. I hope we all got it and there's no confusion here. Let's look at this question as well. Every question we are looking at is so important. Lithium is the mass load. So which client is at highest risk for lithium toxicity? Which client is at high risk for lithium toxicity? A client on low sodium diet, a client taking ibuprofen, a client with diarrhea, and all of the above. All right, let's get it. Let's get it. This is a simple one. You must know lithium inside out. So let's go. Let's go. Let's go. What is the answer for this? What is the answer for lithium toxicity? We have some clients who will be at risk for lithium toxicity, and you must know this. Low sodium diet, ibuprofen. Okay, we got C, a client with diarrhea, and all of the above. We got D, all of the above. Lithium is a must know. You must know it is all of the above, all of the above. If you have a client on the ward who has diarrhea, that client may be dehydrated and is at risk of lithium toxicity. If you have a client with low sodium, hyponatremia, that client is at risk. And if you give your client NSAIDs, that client is already on NSAIDs, that client is at risk. So this question was testing you, and all of these clients will be at high risk for lithium toxicity. So awesome, awesome, awesome. And then there's a trick here. If you really knew the clients who are at high risk for lithium toxicity, if you knew even 2. So when you're answering an MCQ and you realize that, okay, I know that diarrhea that client will be dehydrated and that client is at risk. And maybe you also know that A, hyponatremia, low sodium, that client will be at risk. So immediately you see 2 which are correct, and you do not even know for ibuprofen, know that the answer should be all of the above. So that is another test taking tip. Like you may not know that ibuprofen is bad, but hey, you know that A is bad and then C is bad, but you're not sure of this. So you can't choose A and C at the same time. It's not select all that apply. So that means it's all of the above. So that is a good tip for answering MCQs. Great. So always remember this mnemonic LIT, LITH for lithium toxicity. Know the therapeutic range that it will get toxic when the levels will start going above 1.5. Then clients can have increased thirst, tremors, and headaches. So if you have a client on lithium and you go, the client says, I have some nausea, increased stress, there are some tremors, and client is complaining of headache, start thinking that the clients may be getting toxic. So there are early signs of lithium toxicity. So let's look at this last but one question. We'll be rounding up soon. Remember, pharmacology crash course is coming. We're going to dive into every aspect of pharmacology, so do well to jump on it. So a nurse teaches a client about SSRI, sertraline. Which side effects should be discussed? So select all that apply. Means you can choose more than one. Okay. Sexual dysfunction, weight gain, serotonin syndrome, drowsiness, and urinary retention. So what will you go for? Select all that apply. What will you go for? Sertraline, remember, is an antidepressant. So what are some of the side effects that you should watch out for? And interestingly, we looked at this question for our psychiatry crash course. Yes, we looked at medications that are used in psychiatry. So if you were there, this would have been so simple. So, but let's go. Who has the answers? For antidepressant, sertraline, what do you have to watch out for? Okay, sexual dysfunction, weight gain, great. Then serotonin syndrome. We have A, C, and D. Let's see, we got it. Yeah, A, B, C, and D. A, B, C, and D. So only E is out. So sexual dysfunction, if a client is on antidepressant, SSRI, will come and complain of that. Weight gain, they always have that problem. Then serotonin syndrome, then drowsing. So urine retention is out. So always remember SSRI, they're sleepy, they have sexual issues. So SSRI, I'm sleepy, I have sexual issues, I'm at risk of serotonin syndrome, and then my weight is increasing. So do not forget this, okay? We always want to make it simple for you. Do not forget this. Great. Well done, everybody. Let's look at the last question. So a client asks, which medication, so you remember I told you that pregnancy, you should know some pertinent drugs used for pregnant women and what they have to avoid. A pregnant client asks, which medications are not safe during pregnancy? So which should the nurse flag? Which of these drugs? Labetalol, doxycycline, acetaminophen, and prenatal vitamin. So which of these will have an effect on the client's pregnancy? It's not safe. Let's go. Let's go, let's go, let's go. This is important. You must know it. We have doxycycline here. What else? Doxycycline, peace. Any other? We have B, doxy, okay. B, everybody choose B. Well done, everybody. Yes, remember, I think we've done some high yield reviews on doxycycline and tetracycline and all of that. Yes, so remember that it causes fetal bone or teeth issues. So it has to be avoided in pregnancy. So well done. So doxycycline is dangerous and is dangerous. We will not give it. So remember this and do not forget. So I hope this session has been an eye-opener for you. All the drugs we looked at today, remember to go review it inside out so that you'll be able to answer any question around it. And remember, yes, we are here to encourage you and journey with you. Believe in your ability to learn and grow. You are doing an amazing job. Do not give in to fear, okay? How has today's class been? I want your feedback. The feedback means a lot to me, so that anytime we are preparing for you, you have an idea of what you really need, and we will be here to serve you and be a part of your nclex success story. So thank you. It's been a nice time with you, and see you next week for review of pharmacology again, part 2, and then we dive into the crash course. So I want to see you all in the crash course as well. So thank you all for joining today, and see you next week.